Hi, my name is Angela Smith. This is the procedure for the administering IV medication via mini bag. My name is Angela Smith, Adult Health 1, Dr. or Ms. Lukowski's class. So first thing I'm going to do is verify the MAR, make sure that what the doctor ordered, which in our case he ordered Rocephin, 2 grams. So I'm going to go ahead and grab my vial, clean it. And I have clean hands, by the way. Alright, so my next thing to do is clean the port hub on my saline bag. And I'm going to administer my Rocephin. And place this in the sharps. Grab my bag, turn it. I'm going to go ahead and then label it. Next thing I do is grab my IV tubing. I'm going to label my tubing for date and time. Alright, I'm going to close the clamp. Squeeze the chamber, insert it in. Squeeze it again. Okay. So I'm going to go ahead and run the medication through the tubing. So prime the tubing. Make sure that there's no bubbles in it. Ooh, there we go. Okay. So my medication, my bag is ready. Make sure it's completely clamped off. Alright. Okay, so I'm going to perform hand hygiene now, and I'm going to walk into the patient's room and I'm going to verify who he is. And his Mr. Jones, my name is Angela, again, I'm your nurse as we discussed earlier. I have the medication for you that your doctor ordered, but I need to verify again you're my correct patient. Can you give me your name and your date of birth, please?
Tom Jones.
Okay, and do you have any allergies to any medications?
No.
Okay, good. The doctor ordered Rocephin, which is going to be given in an IV bag over 30 minutes. Have you ever had Rocephin before?
Yeah.
Okay, yeah, good. So we know that some of the things to monitor for would be seizures, dizziness, nausea, vomiting, and a rash. So for the first, I guess, 10-15 minutes, I'm going to go ahead and keep an eye on you, make sure you don't have a reaction. So it's 2 grams of Rocephin every 12 hours. It's going to be given over 30 minutes. And that's going to be, if you multiply everything out with your drop factor set, that gives you about 17 drops per minute. So I'm not going to actually use an IV pump. I'm going to do it by free flow. So I'm going to do hand hygiene, and I'm going to apply my gloves. And first thing I'm going to do is assess the site, make sure that it's patent. Okay. So, is this painful at all when I touch you?
No.
When I compress, good. The site's nice and clean. There's no redness or no swelling. It actually looks intact. So what I'm going to do is draw up 6 mLs of saline, and 3 mLs we'll use for the ASAS process, the first 3 and then the second 3 at the end. So I'm going to unclamp your IV and connect the flush, and I'm going to aspirate, and there is a little bit of blood in the tubing, so we know that it's patent. And now I'm going to start the ASAS process with a total of 3 mLs, and it's a push-pause method. So push, pause, push, pause, push, pause. Okay. And before I did that, I would clean the hub to make sure that it's clean. So scrub, scrub, scrub the hub, hub, hub. Okay, so I clamped off the INT again so I can grab my bag and my tubing. And, okay, this is still clean because I have the tip on the end. And I'm going to re-clean my tip of the catheter to make sure that it's still clean. Unclamp it, take off the tip, connect my tubing. Okay, and I'm going to tape this down on his arm because I don't want it to move. And I'm going to do 17 drops a minute, which over 30 seconds, it will be about 8 drops per minute. So I'm just going to loosen the clamp according to the appropriate drops per second. And because this is an IV arm, artificial arm, it's not going to drop. It'll be about 8 drops per 30 seconds. I meant per 30 seconds. So, okay, so it's dropping at the appropriate rate. And I'm going to stay with him for about 15 minutes, make sure that nothing is happening to the patient. And Mr. Jones, you're tolerating it well. You feel okay? Do you feel itchy at all?
No.
Nausea, vomiting, any dizziness or rash? And we have no seizure activity. Okay, so I can walk away real quick, and I can start my, I can do my hand hygiene first, and then I can start my documentation in the chart, which would be the amount of fluids I administered via the IV bag, the IV site. I would document how the site looked prior to doing it, the time that I started at my initials, and then the condition of the site, which I had already said. So basically that's about it. So I'm going to come back in at a total of 30 minutes, and I'm going to discontinue the IV because it's completely done. Clamp off the tubing first. Mr. Jones, you're still doing okay?
Yes.
Okay. And I'm going to clamp his INT, discontinue the tubing, and I'm actually going to, because I can reuse this tubing, I'm going to make sure I keep it sterile or clean. Okay. I'm going to use the rest of my 3 mLs to do the ASASH process again. The IV site still looks nice and clean, no redness, no swelling, no signs of infiltration. We're going to aspirate once I unclamp. Okay, aspirate the site. We still have a patent IV, so we're going to finish the rest of the 3 ml with a push-pause method. So pause, push-pause, and push-pause. Okay, I'm going to clamp it back off, and site still looks great. No signs of infiltration. You doing okay? Does that hurt? You feel okay?
Yeah.
No, good.
All right, good. So I'm going to take my gloves off. I'm going to perform hand hygiene and finish my documentation if anything's changed, which it hasn't. So again, that would be the date, the time, the amount of mLs that were infused, the condition of the IV site, and how the patient tolerated the procedure, and any adverse side effects or reactions that he had, which was none. And that's it.